We're here today to talk about the Walk Kansas program, and if you could tell us how the program works, what makes it effective?
Well, the program is a short program just to introduce a lot of people to physical activity. It's an 8-week program, and here in Kansas, we run the program through our counties. Our county staff go ahead and promote the program, and the program consists of a team captain and 5 other members of a team. And that team captain is kind of responsible for bringing the team along and reporting their success. There's a goal set by the team, and we set an imaginary goal of 10 miles a week per individual. But the goal is to accumulate some type of physical activity, not just walking, swimming, biking, whatever it might be, to get the heart rate up. And by the end of the 8 weeks, the team will have accumulated enough miles to equal the distance across Kansas, or 423 miles. So it's a wonderful program in that it's easy to manage, and our county staff, our extension staff across the state, have control over their own program. They can modify it, design it in such a way that people like it, and people around March, when we hold it each year, this will be our 7th year, are all excited about getting out after the long winter and participating in this activity.
We mentioned earlier that Walk Kansas is a behavior change model. So what parts or components of this program fit that model or make it effective for those who participate?
I think one of the key components of the program that seem to make it work have to do with the social norming, the group cohesiveness, group support that keep people moving and keep them involved. Usually when we talk about a physical activity program, someone will start it up and last about a week and then stop. And this program keeps people motivated, and I think that has to do with that social part where team captain chooses their own friends to be on a team. And so there's already a group kind of cohesiveness, and as a team captain and team members, they work together. Not that they do the physical activity together, but they work on the goals together. And there's a goal, of course, of the 423 miles, or the distance across the state that they're working on. And as they report each week, team members are saying in their mind, I've got to get out and get my activity, my physical activity done. I don't want to let the team members down. And so each week, each team member reports that goal at least 2 miles a day for 5 or more days a week. That seemed to be one of the strongest components of them, working together, wanting to reach their goal of making it across, at least across the state and maybe further, and of course not letting people down. That's one of those parts of the program. Others too, that we add some small components to help them. We have some reinforcers, like a newsletter that comes out each week that's encouraging them, giving them more information about the health benefits of physical activity and good nutrition. They are able to choose their own name. They wear a Walk Kansas t-shirt. They usually buy one of those. There's just a whole host of things that we've put in the program as we've looked at what causes people to stay motivated and their incentives. Usually there's a celebration at the end of the program where individuals that have achieved the goal of 423 miles are rewarded with prizes. We try not to give a prize for the most miles because we don't want the kind of competition that sometimes enters in. But so there are incentives, a variety of things that are added to it to keep enthusiasm up and to keep people walking or swimming or biking for that 8 weeks.
Well, in just summary of our discussion, how would you say that theory has influenced the development and the implementation of the Walk Kansas program?
When we designed Walk Kansas, we brought together some researchers who are knowledgeable about theory and motivation and what it takes to change behavior. So we got people from kinesiology, then we got local agent input, and then other people on the state level, promotion type people, media people. And then we designed the program using the components of theory. The theory that most closely lends itself to this is the social cognitive theory. And with the social cognitive theory, it has kind of a three-pronged approach to changing behavior. As you look at, say, a pyramid, on the top would be the behavior that you want to change. And on one corner of the pyramid, you would see the person itself. On the other side of the pyramid would be the environment. And so as you study this, you say, now what will make this individual change and control their behavior? So on the personal side, if we could provide education and skill level and some of those things, that would help the individual to change behavior. For example, if we could teach someone how to play racquetball and play it well, they would be all excited about getting some physical activity. And as that skill level would come up, there would be a gradual change in their behavior. They would have a desire to change, their behavior and to stay with that type of behavior. Now, on the environment side, as you think about the environment, what is it in the environment that would help that individual to be influenced about behavior change and want to get more physical activity? Well, if they worked in an office where everyone was talking about physical activity and how good it feels to get out, they would start having the feeling about, maybe I ought to try it. Or if you moved to a place where there was a gym across the street and you saw all of the people pouring in, that would be an structural environmental thing that would have quite an influence on you. Or if your boss got real excited about physical activity and put in some exercise cycles in the break room, there would be another structural type things that would take place. So the behavior, the environment has an effect on the individual's behavior, on the person, and then that will affect the individual's behavior. Environment can also be influenced or influence behavior change. We talked about the behavior change a little bit, but I used the example of the boss. If everyone is crying at the office for some kind of physical activity equipment, all of a sudden the environment changes, and it has influenced the environment. So he starts putting in a nutrition bar where they can eat, during lunchtime. Takes out the candy and the soda and puts in juices and other snacks that are more nutritious. All of a sudden you can see some of the changes that take place. So as you think about what we did, that's the model that we use to influence the change that we want to see in people, and that's worked real well.